Thank you so much, Dr. Benson, for giving us this wonderful perspective. I first want to take a few minutes to reflect on what we mean when we talk about integrative medicine. The term integrative medicine is relatively new, and it came about in an effort to sort of join together conventional and what we call alternative medicine or complementary medicine, or affectionately CAM. At the moment, research in integrative medicine mostly aims at testing the efficacy and the mechanism of these CAM therapies or practices, like, for example, acupuncture or meditation. But it is also useful to think of integrative medicine in a broader sense. Oops. Broader sense, sorry. Which is to arrive at a fundamentally deeper understanding of the human body and health that underlies both conventional and alternative medicine. Conventional medicine suffers from being compartmentalized, from the long-standing physiological separation between systems and body parts. Many alternative practices, however, have a holistic view of health and disease that has begun to dissolve these artificial boundaries. This view of integrative medicine has a lot in common with other like-minded integrative disciplines within medicine, such as systems biology, for example. What is unique about integrative medicine research, however, is that it derives its concepts and hypotheses from healing traditions that are outside of what typically is taught in medical schools and in basic biomedical science education programs. Making more and more connections between integrative medicine and other like-minded disciplines, like systems biology, and across traditional organ-based biology, will contribute to an ever-expanding understanding of human health and disease that will apply to all of medicine. This expanded understanding at a basic level, at the physiological level, is essential to the full implementation of integrative medicine into medical education and patient care. Now, Boston is a truly unique environment for integrative medicine, as it contains multiple integrative medicine centers within several institutions, many of which are represented in today's program. However, the sheer size and complexity of Boston, and particularly Harvard Medical School, can be an obstacle to working together and can result in groups of people operating in a vacuum. In other words, integrative medicine is not as integrated as it could be. One of the main goals of the Osher Center is to help connect the large number of individuals and centers that do integrative medicine research, education, and patient care, but that may not yet be collaborating or may not even be aware of each other. At the Osher Center, we decided to build a map to see how connected this network may be. Each dot on this map represents a person, an individual, that has published at least one paper on a topic related to integrative medicine. This map identified an impressive 670 researchers connected to 19 institutions, including Mass General, Brigham and Women's, Dana-Farber, Children's, and BIDMC, and many other institutions. And you will be hearing more about this map from David King, who's the CEO of Exactive, who built this map for us. Hopefully, most of you have already seen this network map on our website and had the opportunity to navigate it on your own. In the map, people are linked to each other via publications that they have published together, and are also linked to their parent institution. The map clearly shows that an impressive amount of connections exist between people, and through these people, between institutions. Today's meeting is a physical embodiment of this network map, and it's wonderful to see how many of you are here today. The goal of this forum is first and foremost to get to know one another, We hope that some of you will find new colleagues with common interests and new opportunities for collaborating, sharing, and leveraging of resources. You will hear presentations by leaders of 9 different integrative medicine centers and programs, 7 at Harvard Medical Schools and 2 at neighboring institutions, Tufts and Boston Medical Center. We are painfully aware that there are many other integrative medicine research groups that we were unable to include in this program due to lack of time in this very short half-day event. However, we hope that this forum will be the first of many and that future more extensive events will allow even more voices to be heard. We understand from our survey that many of you are interested in education and patient care. Although this inaugural forum is primarily focused on research, an important future goal of the Osher Center is to represent existing educational and clinical networks as we have done for research. Input from this forum will be an important first step in this direction. What will happen as a result of us meeting today? Will the network change as it becomes aware of itself and of us having gathered here for the first time? How might we want to influence the growth of this network? Will becoming a conscious network give us more collective strength and visibility as a group? Our keynote speaker, Dr. Albert Laszlo Barabasi, is an expert in networks, and he will talk about the science of networks and what we can learn from measuring them and understanding their behavior. Dr. Barabasi is the Robert Gray Dodge Professor of Network Science and a distinguished university professor at Northeastern University, where he directs the Center for Complex Network Research. He holds appointments in the Department of Medicine at Harvard Medical School and Brigham and Women's Hospital in the Channing Division of Network Science, and is also a member of the Center for Cancer Systems Biology at Dana-Farber Cancer Institute. Dr. Barabasi's work led to the discovery of scale-free networks in 1999, explaining their widespread emergence in technological systems from the cell phone to the World Wide Web. Dr. Barabasi.
Thank you.